I'm Bill Radke. Hi, thanks for tuning in today. Let us start the show by checking in on the pandemic and other news with the executive of King County. Dow Constantine takes your questions on Tuesdays, but only if you'll call us at 206 543 KUOW. Area code 206 543 5869. Executive Constantine, welcome back.
Good afternoon, Bill. How are you?
Good, thank you. Last week we said there was concern about a possible fourth wave of COVID cases because of the new variants of the virus and people congregating more. What's the latest, please?
I don't think there's any question. There is an upsurge in the virus. We're up to 174 cases per 100,000. It was 131 last week. That reproductive number, the RE number, is 1.6. You'll remember not too many weeks ago we were down below 1, which is the target. So all across the board, the statistics are bad. We really need folks to do what I say every week, which is follow the public health guidelines, mask up, avoid being cooped up with others, stay home if you're sick, and generally recognize that this thing's not over. Even if you've been vaccinated, please wear a mask. And of course, we really need folks to get vaccinated if they're eligible and have not yet gotten their shots.
Yeah, last night I saw a digital sign over I-5 in Kent said something like, wear your mask even if you're vaccinated, which, it's a small sign, hard to say everything. It didn't say indoors or with strangers. And this is all sort of new to people, the vaccinations. And so what is your brief guidance on being vaccinated and still masking up?
Well, the CDC and our own public health folks say that you still need to wear a mask. It is possible to get infected and to pass infection on to others, much less likely, of course, but still possible. And also it makes it enormously difficult for folks who are trying to navigate out there to know who's been vaccinated, who hasn't been. So it's just more polite and better for everyone if everyone just goes ahead and masks up. A lot of side benefits, including a remarkable flu season this year where apparently we've experienced no deaths from influenza. There's going to be a lot of conversation after this pandemic's over about how we conduct ourselves in the future to try to tamp down some of these other infectious diseases. But I will say this, we got, and you may be asking about this, but we've got quite a few people who are eligible now who still have not gotten the chance to get vaccinated. We're getting about 90,000 first doses this week. But next week, a week from Thursday, every other adult, everybody else over the age of 16 becomes eligible, and that is going to be hundreds and hundreds and hundreds of thousands of newly eligible people, 600, 800,000, with really no appreciable increase in vaccine availability. So we're going to have a challenge for a while to come.
Yeah. I checked the vaccine locator site to see if I can schedule an appointment now for after April 15th when I will be eligible. And the site said, no, you can't do that. And yet I've heard that, for example,
you're not supposed to be able to do that.
I suppose I could lie, but the site said don't do it. It was clear. But I have heard that, for example, that Yakima County is letting people do that. Does that sound true, or is it varying across the state?
I don't know the answer, but they've continued to have a better supply in some of the rural and eastern Washington counties than we've had here in King County, just because we had so many eligible people to start with, having so much of the sort of healthcare industry here in our county. And so that has continued to try to work its way through the system. If they're doing that, well, they have to take that up with the State Department of Health. Here, although it is, obviously completely an honor system, the rule is you're supposed to wait until you're eligible to make an appointment. And I'm going to do that. And then I am going to spend a lot of time scurrying around trying to find a place where I and my wife can get our vaccines.
Yeah, me too, including traveling. Is there, I think I've asked this before maybe, but is it by now, is it okay to travel wherever you got to go to get an appointment, where there used to be the feeling of, hey, those are for, people in Yakima or whatever it is. Is that game on?
I don't think there's anything illegal about doing that. I think that there's, a question of personal ethics or morals that you got to consider. Are you taking it away from someone who needs it more? As we move into this next phase, though, everybody's eligible as long as you've reached the age of 16. So it really is going to be just waiting for the doses to arrive and seeing how safe you can keep yourself in the meantime. I will say that at the current rate and based on the projections we should have 70% of the adult population vaccinated by the end of June. And that is a significant milestone, though not where we want to be. We want to get to 100%, obviously, which is not ever. We're never going to get quite to 100%. But we're rooting for the administration and these manufacturers to keep increasing the supply, and hopefully we can get there faster.
I'm hearing about traffic backups on the highway and spring break lines at SeaTac Airport. Is there any chance you or the governor, I guess it would be, restrict any travel or business capacity, gatherings, take a step backwards, or is that you're pretty sure that's not going to happen?
Well, I think there's a significant possibility that we may be moving backward from the phase 3 that we're in right now. I mean, the limit that was set was 200 cases per 100,000 people. And that is on average over the course of 2 weeks. And we are headed in that direction. So that will be a call by the governor and the State Department of Health. It would be a shame if that happened. All we have to do is be a bit more careful, and folks can go about their business. But in order for us to be able to avoid another catastrophic spike here before we get enough vaccine to reach that elusive threshold of herd immunity, people are really going to have to be conscientious.
This is the King County Executive, Dow Constantine. He'll take your questions, and that phone number right now is area code 206-543-KUOW, which is 206-543-5869. Grace called us, is not on the phone, but left this question. Can Dow, she's comfortable calling you by your first name, can Dow comment on future availability of J&J vaccine? That's Johnson & Johnson. I want to get that one, and I can't seem to find it. Will it be more available soon?
I don't know the answer to that. I'm sorry, but I will try to track that down. In fact, maybe somebody can tell me right now. The fact is that we have not received much of it, and we don't have any real predicted uptick in the J&J vaccine. It's a really good vaccine. It's particularly good for populations that are hard to track, whether it's folks who are living homeless or folks who are in detention. But also, if you just don't want to have to get 2 appointments and go get 2 shots, one and done is a really good way to go, and it will provide a high level of protection. So we're anxious. You saw that 15 million doses were spoiled by a subcontractor. But we're
in
anxious,
Baltimore.
In Baltimore. We're anxious for them to get that production going because I think it's a really good solution for a lot of folks.
Yeah, and speaking of getting people who have trouble in different ways to getting the vaccine, especially 2 doses, I saw the Paul Allen Family Foundation's giving the county some money to get vaccines directly to underserved communities. What do you want our listeners to know about how that's going to work? I think these are mobile teams. Yeah,
and this is bolstering our efforts through mobile teams and community outreach to get vaccines. We talked a little bit about this last week as well, to get outreach to those who are not well served by established systems. And this is a big county, and there are a lot of folks who are not as wired into the established systems as you and I are, and we're so grateful to the Allen Foundation, and really, remembering Paul Allen. He did a lot of good for this community, and the money that he set aside is continuing to provide benefits for us. And this, this is our mission. Our duty is to make sure that every person, not just those who are the most able or the most well-connected, has access to the health care they need. And we are bound and determined to do it. So could not be more grateful.
Okay. I do always want to try to get to things besides the pandemic. We're taking your questions, whatever that is, 206-543-KUOW. I did want to ask, the Sounders home opener is in 10 days. They're going to be allowed 7,000 fans at the same Seahawks stadium. We got the Mariners at 9,000 fans. Does the county have any way of tracking these events for COVID transmission, or are you just guessing? How many do you have a guess of how many new cases, or you think it's 0, or what?
So I went to the Mariners opener, and I thought that he did a great job of figuring out how to space people apart, keep it very carefully monitored. They had actually gone through with zip ties and eliminated huge chunks of seats so that when we were sitting, my wife and my child, there was no one anywhere near us, out there in the evening breeze. So it really felt quite safe. The Mariners and our public health folks say that there are areas of the ballpark or the stadium that are harder to make perfectly safe, like the restrooms, for example, but they've done a lot in terms of trying to increase the airflow and so forth. What I would say is that the franchises have the contact information for the people who are attending. Our public health folks have been working closely with the franchises to make sure they're following reasonable rules to prevent infection. And, when I look around and I see what people are doing in their day-to-day lives, what I saw at the ballpark seemed considerably less risky than a lot of what else I see. The problem is, if you've got one person who has a high viral load there, they may be able to infect quite a few others. And so there is a significant risk still. I would encourage anyone who is vulnerable, if you're older, if you have an underlying health condition, to think twice about attending until you've gotten your vaccine. But I do think that the franchises have done a magnificent job stepping up and figuring out how to, return to something that's a little more normal, but still safe under the pandemic conditions.
This is King County Executive Dow Constantine. A listener named Matt has called area code 206-543-KUOW. Matt, what would you like to know?
Hi, Executive Constantine. I have noticed that the governor's website does not have a guideline for phase 4 on it currently. I'm wondering if us going to phase 4 is at all contingent on vaccination levels in other states, because I'm a little concerned that there won't be the same level of compliance in some of these other places.
I mean, you can be assured there's not the same level of compliance in other places. We did not get to have the lowest rate of infection by accident. It's because people are following the rules, people are conscientious, and we appreciate it. I don't know the answer to your question about phase 4. As I just expressed, I'm concerned about us having to go backward to phase 2 from phase 3 right now, which would be really burdensome for a lot of business owners in particular. I don't even know what it would mean for my started in-person first grade yesterday. But the fact is that we are part of a larger community. There are a lot of people traveling. CTAC just had their busiest travel day in more than a year. So what is happening in other jurisdictions significantly impacts us. I am reminded that the State Department of Health and the governor's office is in charge of determining what the triggers are to go to the next phase. And I am confident that they're going to keep monitoring and modifying those to be up to speed with the evolving understanding of this virus and the level of vaccine around the state and country.
Yeah, I think I heard you use the word significant. I mean, that's a little more, guess likely than I was expecting. And that's news to people who are trying to run a business and are worrying about whether we go back to phase 2, or as you say, schools. And,
So, the triggers are, 200 cases per 100,000 over a 2-week period. Those average 200 cases, and with hospitalizations increasing, and those things are coming up. We can see them coming towards us on the horizon. So unless we are able to modify behavior and get this thing wrestled to the ground, we're going to face the possibility of having to move backward.
Yeah, we're looking at 200 per 100,000 people, but are we testing enough?
And right now we're at 174 right now as of today. So.
Yeah, but it seems like testing is not even as much on people's minds as it used to be. Are we testing enough to know when we're at 200?
I think you raise a good question. I still get tested every week, but I think that, the folks at the testing facility I go to say the demand has dropped way off. Yeah. Obviously people who were anxious about it got the vaccines as soon as they could, so they're not getting tested anymore.
Yeah.
But I think a lot of people are just kind of letting down the guard a little bit. And
well, then is 200 cases the appropriate benchmark? If we think that we're testing far less.
I'm way out of my depth now.
Okay.
That's what the public health experts have helped the governor determine. So I have no reason to think that I have a better answer than that.
Okay. It seems intuitive to me, but I have not received a call from your public health officer yet for me to figure that out. This is the King County Executive, Dow Constantine. We have a call from, I believe it's Estra, who's in Sammamish. Estra, thank you for calling. What would you like to know from the County Executive? Estra, we cannot hear you at all. You're so breaking up. But my producer did write down what your question was. And sorry we can't hear you, Estra, but the version I have is there's a lot of talk about the new variant that's more contagious. What does that mean? Can I still wear 2 masks and feel protected?
My understanding is wearing 2 masks is still considered to be the sort of better practice. Yeah. The new variant is clearly responsible for some of this uptick we're seeing. I don't know how much it's responsible for. You probably saw a lot of publicity yesterday about the fact that it seems to be infecting and causing problems for younger people, young adults, even children. Mm-hmm. So it is a real thing, and it is quickly sort of moving to the front in terms of the COVID challenge, displacing the original virus that we had. I'm reminded that this is the one that was started in the United Kingdom, and it seems to, or was first identified there, and it seems to cause more severe illness. But the good news is the vaccines are highly effective against it. So please get your shots as soon as you're able, and we will get through this together.
On another topic, Executive Constantine, the King County jail system just got audited. The Seattle Times sort of top-line summary is, Black people jailed in King County generally face harsher discipline and more restrictive confinement than incarcerated people of other races, and fights, assaults, and other violent episodes that occur frequently within the county's 2 adult jails are partly driven by the practice of double bunking or putting 2 people in the close confines of a single cell. There's more, but do you accept those conclusions and the audit in general? And if so, what are you doing about that? Executive Constantine? Oh, yeah, I kind of lost you too. Can you hear me? I don't hear the executive. I'll give you a moment to walk around your home or wherever you are or outside, and then we'll just move on. We've got plenty to talk about this hour. We're talking with the King County Executive. Hello, yep. Now I hear you. So I summarized. I gave the Seattle Times little.
Yeah, I got it.
You got it. Okay. They sound.
My answer was brilliant, but
sorry,
it was off the air.
Continue, please.
The Department of Adult and Juvenile Detention, hereafter DAJD, is taking the auditor's recommendations very seriously. They come into kind of 3 categories: the racial bias, safety concerns, and then just the issue of so many people with behavioral health or psychological challenges in the jail. If the assertion is there's racial bias in the jail, that should surprise absolutely no one. If anyone's surprised at finding racial bias in systems in the criminal legal system or other systems like healthcare or education in America, they have not been paying attention. We have been working very hard to improve operations at jails over time and have been very successful in that. But there are good recommendations here that we can follow up on. Well, remember, we're under consent decree a decade or so ago with the Department of Justice having come in and demanded changes, and those have been made successfully. And the Department of Justice comes every year and inspects the jail for a range of issues and has passed our operations. This jail, the downtown jail, is particularly difficult to operate. And in my State of the County address last year, I said it was old, it's outdated, and I want it closed. And in order to do that, we have to first continue to reduce the population as we have during COVID, and that requires cooperation of an awful lot of independent powers, judges, police, etc. And we need to find better alternatives, from prevention to diversion to more psychological or behavioral health care, rather than dumping the challenge of an underfunded behavioral health system into the jail, as happens now. I will say that the DAJD takes issue with the way in which the auditors or the analysts, the council auditor, lumps together the different types of infractions. They think that their analysis is fundamentally not right because they've not used the data correctly. And so they're bringing in someone to independently look over the data and look over the operations to understand what we can improve and the extent to which the auditor is correct.
Okay, well, once again, the pandemic dominated the time we have together, but I would like to talk more about, because there's so much in this audit report, and to some extent you push back in some ways, and I want to know more about what the county's doing and will do. So let's pick this up another time. And thanks for your time.
It is a really, it's a good opportunity, but we also need to make sure everybody is agreed on what the terms are of the conversation.
Yeah, more to say. King County Executive Dow Constantine joining us as he does Tuesdays and taking your questions. Thanks for the questions. And Executive, thank you for your time.
Thanks so much.